So you've been researching. You've watched a few videos, read a few things, maybe even spoken to someone who's been through this. And part of you is thinking, okay, I believe this might actually work. But another part of you is also wondering, what does it actually feel like? What's going to happen when I get treatment? These are questions I hear most often from new patients, even patients in the first couple of weeks of our program. And they're exactly the right questions to be asking. Today, I'm going to walk you through the first 4 weeks of our neuropathy treatment program because I think that one of the reasons patients give up too early is that they don't know what exactly to expect. They feel uncertain. They may not see any huge dramatic change they hope for in week 1 or 2, and they assume that treatment isn't working, when reality, there's a lot of things going on underneath the surface. And the most important changes are already happening. We just can't recognize it yet. I'm Dr. Rebecca Gibbons, and this is episode 5 of the Neuropathy series. By the end of this video, you're going to know what your first 4 weeks of treatment are going to look like. So let's start. Before we get into the week by week breakdown, let me tell you what happens before your treatment even begins, because preparation matters for setting the whole program up for success. That's what it's all about. We want your treatments to be very successful. And here's how it works when you're ready to take that first step. So you call us, my assistant sets up an appointment, and you come in to meet me in person, and we have a conversation. The consultation is a real conversation. It's your history, your symptoms, what you've tried, what your life has looked like with this condition, what you want your life to look like after treatment. We also do a neurological assessment called the Toronto Clinical Scoring System. It's a standardized test that tells us objectively where your nerve function is right now, which gives us a baseline we can measure your progress against as we go. It's just like a 5 or 10 minute test. So after that, I'll be straight with you. First, are you a good candidate? How many treatments do I think you'll need? And what's the realistic timeline for treatment, and when could you expect to see improvements? You'll leave the consultation know exactly what I think and what the plan is. And if you're ready to start, we don't make you come back for a separate appointment. We treat you the same day. And usually it's a 30 to 40 minutes right after the consult. So you'll walk out already having begun. So what would you want to bring to your first appointment? A list of your current medications, any relevant test results or imaging, and most importantly, a clear description of your symptoms in your own words. When did they start? Where are they? What makes them better or worse? And the more specific you can be, the better we're able to treat you and have a better outcome. So let me go over what week 1 will look like. You've come in for the first 2 or 3 sessions, the needles go in, and most people are genuinely surprised by how undramatic that is. You think needles, you think pain. It's not like that. So it's more comfortable than a lot of people anticipate. Many patients are relaxed enough to doze off. Some are playing on their phones, some read their books, and you're usually relaxed within 5 minutes. After your first session, you may notice a few things. Some patients feel a mild fatigue, almost like they're feeling after. And that's a good sign because it means that your nervous system has been engaged and is processing the treatment and starting to heal. So you would rest if you feel like it, drink water, give your body the space to respond. Some patients notice a subtle change in their symptoms even after session 1, a slight softening of the burning, a period of unusual calm in the evening. Others notice nothing at all, and both, I'll be honest, are completely normal. The honest truth about week 1, most patients do not experience dramatic change in the first week, and that is completely expected. What is happening in week 1 is not visible to you as physiological. Your body is beginning to increase circulation to the nerve tissue. Inflammation is beginning to reduce. The vascular environment around the damaged nerves is starting to shift. These are foundational changes, and they take time to translate to recognize it. So expecting dramatic results in week 1 is like planting a seed and expecting it to fruit the next morning. So what I tell everyone, new patient at the end of their first week, your job right now is just to simply show up. Consistency in these early sessions is more important than how you feel after any one session. You are building physiological foundation, and every session adds to it. We will also be assessing how your nervous system is responding and making adjustments to your point selection and treatment plan based on what we observe. So your treatment plan in week 3 will already be more refined than your treatment plan in week 1, if that makes sense, because we'll know more about how your body responds to each treatment each week. It gives us just more information the more treatments we do. So by week 2, most patients begin to notice something. It's rarely dramatic, but it's there. And it gets people excited too. And recognizing it matters as well, because these are early signals, are evidence that the treatment is actually working, even when you can't feel a full recovery yet. So the most common early signals I hear from patients in week 2 are that your sleep improves first. This is the most consistent early win that we see. Patients who have been lying awake with burning, shooting pain in their feet often report sleeping through the night, or they don't have to get up and walk around, or at least sleeping better before they notice significant change in their daytime symptoms. We notice the nighttime symptoms first. The nervous system starts to calm down enough during sleep to allow rest that hasn't been possible in probably months or years. If this happens for you, pay attention to it. It's really meaningful. Sleep is such a great time for the body to heal. Also, the burning may be slightly less in the mornings. The tingling might move, sometimes spreading before it concentrates, which can feel strange, but it is actually a sign of nerve activity changing and the nerves starting to wake up. So some patients describe their symptoms becoming more predictable, still present, but less chaotic. Occasional windows of relief. There's brief periods, an hour, an evening, or even a morning where the symptoms are noticeably less. These windows are really important. They are your nervous system showing you what is possible. It's rewiring. It's kind of a preview of what's to come next. Temporary symptom fluctuation. Some patients experience a brief period in week 1 or week 2 where symptoms seem slightly more active before they start to calm down. This is not unusual in acupuncture treatment and is sometimes called a healing response. So what that is, it typically resolves within 2 to 3 days. If you experience this, let us know. I usually adjust the treatments accordingly. It is almost never a sign that something's going wrong. It's kind of a recalibration. So week 2 is also commonly the week where doubt appears. I want to address that. You've had 4 or 5 sessions, you haven't had the transformation you've hoped for, and the voice in your head says, maybe this isn't going to work for me. I want to speak directly to that voice. You are in the middle of a physiological process that takes weeks, not days. It's not a one-size-fits-all. The absence of dramatic results in week 2 does not predict the outcome of week 8 or week 12. Stay the course, be consistent, show up for the sessions. This is the job right now. It's kind of like when you're starting a new workout routine. Those week 1, 2, 3, 4 can be difficult. So we just want you to show up. In week 3, we build. Week 3 is often the week things start to feel different, not just occasionally, but consistently. This is where the cumulative effect of the treatment begins to become undeniable. What patients commonly report in week 3 are sensation changes that feel like progress. The numbness may begin to lighten in certain areas. Patients who haven't felt their feet properly in years sometimes describe a strange new sensation. Not quite normal feeling, but something they haven't experienced in a long time. This can feel unfamiliar. That unfamiliarity is actually recovery. So reduced burning intensity, not gone, but measurably less in week 3. Many patients begin reducing how much they think about their symptoms, which is itself a significant quality of the life shift. When the pain is no longer the loudest thing in the room, everything else in your life gets a little more space. Improved balance and confidence in movement. This is huge. This is one of the most life-changing improvements, and often it arrives in week 3 or week 4. So the proprioceptive nerves, the ones that tell your brain where your body is in space, begin responding to treatment. And patients who were unsteady on their feet notice they feel more grounded, more stable, less afraid of falling, and they have just better energy and mood. Chronic pain can be exhausting, not just physically, but mentally. And as the nervous system begins to calm, many patients notice they have more energy, more mental clarity, and a better overall sense of well-being. This is not incidental. Pain modulation and mood regulation are deeply linked in the nervous system. Week 3 is also when we have our first progress conversation. We sit down and review what you've noticed, what we've observed in your treatment response, and what adjustments we want to make going into the second month. This is not a check-in for its own sake. It directly shapes the next phase of your care. So your feedback is data. It helps me to move forward. It tells us what we're working and where we need to push harder. Now, let's go into week 4. You've had 10 to 12 sessions. You know the routine. You've seen some of the changes. They may be subtle, they may be significant, and you're at an important crossroads. This is the moment where some patients think, I feel a little better, so maybe I can taper off. Come once a week instead of twice. They may take a few weeks off, see how I feel. I understand that impulse completely. I've seen it a lot. Life is busy. Treatment takes time and commitment, and feeling a little better can trick the brain into thinking the job is done. It's not done. And I want to be genuinely honest with you about what happens when patients pull back too early. What we consistently observe when patients reduce sessions too early is that the gains that we made begin to fade. Not overnight, but gradually. The burning starts to creep back, the sleep worsens, the windows of grief get short, the relief gets shorter, and it stops, the nerves start receiving that recovery input, and we start to revert back to the previous state. This is not failure, it's biology. Nerve regeneration is a sustained process. It requires sustained support. So pulling back at week 4 is like stopping a course of antibiotics because you feel better on day 5. The infection isn't gone, and stopping early gives it the chance to come back stronger. So week 4 is actually the beginning of the most productive phase of treatment, not the end of a trial. The foundation has been laid. The body's repair mechanisms are active and building. And what happens in week 5 through week 12 is where the most significant and lasting changes occur. Lasting changes, that's what we're going for, not just quick relief. The patients who look back after completing the full program and say that changed my life, they are almost always the patients who committed fully through week 4 and kept going. That's not a coincidence. It's not luck. So what does week 4 look like in terms of how you feel? Most patients at week 4 are meaningfully better than they were at the start. Even if they aren't where they want to ultimately be, they'll be sleeping better. Their symptoms are more manageable. They feel hope in a way they haven't felt in a long time. The improvements you've seen in week 4 of what you're going to look like and feel like at week 12. Weeks 5 through 8 are when most patients experience their most consistent and significant improvements. It's really exciting to see. and sensations returning in the areas that have been numb for years. Balance often is restored, burning that has reduced from an 8 to a 2, sleep feels like sleep again. Weeks 9 through 16 are about deepening and stabilizing those gains, consolidating the nerve recovery so that the improvements hold independently without requiring the same frequency of treatment. Every patient's timeline is a little different, and I have patients who have experienced dramatic changes in week 3. I've had patients who were patient through week 8 before they had their breakthrough, and who were enormously glad that they stayed and showed up. The biology sets the pace. Our job is to show up consistently and trust it. It works. The question we're sitting with is, what would your life look like 16 weeks from now? You were sleeping through the night, walking without fear or falling, and not planning around your day around pain. That outcome is available, but it requires commitment and consistency and some time, but it is available. So if you've been watching this series and thinking, I want to be one of those patients, I want to invite you to take the first step. That step is simply giving us a call, and we'll have a real conversation about your situation, where you are right now, what you've tried, and what your goals are. Where do you want to be in 4 months? You can learn more about our neuropathy program and read about what we do at awpensacola.com. And when you're ready to talk, give us a call at 850-530-1028. In episode 6 of the series, I will talk more about actual patient successes, those who went through our full program. So make sure you're subscribed if you don't want to miss it, or if you don't want to miss any other videos. I'm Dr. Rebecca Gibbons. Thank you for being here, and thank you for giving me your time. I'll see you in episode 6.